Medical professionals of Reddit, what was a time where a patient ignored you and almost died because of it? Me. Didn't almost die, but I was very sick. I went for a mini vacation in Batam, Indonesia, where our villa had a private pool. Throughout our 48-hour stay, I spent more time in the water than out. The time I wasn't in the water, I was in our air-conditioned villa room with just a t-shirt, now damp, over my swimsuit. In the day it was blazing hot, and at night it was super windy because it was near the sea. I am also asthmatic. While it's mostly under control, I usually get a tight chest feeling when I am ill and haven't had a full attack in years. I fell sick after the trip. High fever, runny nose, cough. I am also a healthcare professional. I studied life sciences and diagnostic testing. I am hardly bothered and can take care of myself when I get sick. Eventually the fever went away and I was left with a cough. The week after the vacation, I was still having a cough, and we went to play paintball. Completely overexerted myself running, ducking, crawling, what have you. After the game, we went to a friend's place to have lunch and chill. I fell asleep but woke up coughing with the feeling of something being stuck in my respiratory tract. I thought it was phlegm. Went to the bathroom to cough it out but nothing was happening. I lost track of time and apparently I was in the bathroom coughing away for about 30 minutes. Friends asked if I was alright and I just kept saying yeah, it's just a cough. I think there's some phlegm stuck and I'm trying to get it out. Finally went to see the doctor, my regular GP, the next day. Turns out I was having a very serious asthma attack. I just couldn't recognize it because I haven't had one in many years. Worst thing is this was the same doctor who told me to always carry my inhaler around just in case, but I just wasn't diligent about it. Until now, my friends would yell it's just a cough, I'm fine whenever I make even the smallest cough or sneeze. Now that I think about it, I actually could have died. Asthma is the freaking worst. Always have to carry around that weirdly shaped inhaler that never fits comfortably in your pocket. Because God forbid I walk up some stairs, or laugh, and suddenly I'm on the verge of suffocation. Thanks body. Not 100% what you're asking for, but like 80%? Like 50%. Anyway, when I worked in an assisted living facility, one of our residents, lil old people kind, not step kind, came to the nurse's station and said you might want to check on Jane. Jane's sitting in an armchair totally silent, staring ahead, left pupil blown, can't speak. 911, CVA, turned out to be a shire, yay. Procedure mandates we call family anytime a resident is sent out. Cheap butt daughter, CD, answered the phone. SM is me, severely moderate. SM, mom, I need to inform you we've had to send your mother to the emergency room. CAD, what, why? SM, well, we have to wait for the doctors at the hospital to diagnose her, but she appeared to be having a stroke. CAD, does she have to go to the emergency room for that? Can she not just go to emergent care? SM, seeing as how a stroke is literally the death of brain tissue and she is acutely at risk for another stroke at any second, which could easily kill her. No mom, she cannot go to an urgent care clinic for this. CAD, huffy sigh, she is just plowing through the money dad left. SM, she'll be at Madup Hospital, on HIPAA Avenue if you'd like to meet the ambulance there. My grandfather Sebastian lost his virginity at a brothel on HIPAA Avenue. Most discreet W in the business, he said. Work as a medic on an ambulance. Got called for a female short of breath. She was in her 50s or 60s. We get there and it's obvious she is having a real hard time breathing. Her oxygen saturation is 60%. Normal is 95% or higher. We gave her oxygen. Get ready to get her loaded up. She doesn't want to go. We do everything we can to try and get her to go. Absolutely will not. We explain she will die if she doesn't go. Nope, not going. Take our oxygen off and leave. 2 hours later, another crew is sent back, fire someone not breathing. Never got a pulse back. So not an almost died. She did die. Not a medical professional, but my dad had a really serious cough that I told him he had to get checked out. He ignored me for weeks and coughed and coughed. Eventually, he coughed up blood and I essentially forced him to go to the doctor. He was diagnosed with TB. I am vaccinated luckily, and if he had left it any longer he would have died. This happened a little while ago now, but for most of the duration of his cough he was overseas. He works for Trinity and gets paid to work in places like India, China, Korea etc. And we FaceTime call regularly. So luckily I wasn't around him very much for most of the duration of his cough, or presumably when he first caught it, and it was maybe a day after he came home after being abroad that he coughed up blood. I did get tested at the hospital and no, I don't have TB, but I didn't know the vaccine was so ineffective, and I guess I'm really lucky I wasn't around him a lot. Go and get yourself checked. BCG vaccine does not prevent tuberculosis in adults. It prevents serious forms of it and complications in kids, but it does not protect you for 100% against TB. In case you are infected, but the disease is not yet progressing, they can put you on a prophylactic regimen with just one drug, as opposed to a mix of several drugs. You don't want TB, believe me. This doesn't exactly fit the prompt, but I was advising a patient to go to the ER because his blood potassium levels wear off, which can cause a lot of problems. He argued and argued with me about it, but in my position you can't force anyone to do anything. Long story short, he didn't go to the ER. He dead now. Fits nicely here, I think. I've seen a lot of heart failure patients as a student. These people have problems with swelling, and are often told to follow low sodium, low fluid diets, and need to be taking diuretics. People often call them water pills. There's always a handful that never follow these instructions and don't take their medications, and they need to be admitted every few weeks, months. They have liters, yes, multiple liters, of fluid diuresed, peeing out of them. This one super obese woman, BMI 50, had like 40 liters taken off of her in a couple weeks. I don't know how she could breathe. Imagine having so much fluid stuck in your legs you could probably fill up a kiddie pool. As mentioned a lot in this thread, a lot of this is facilitated by their own lifestyle and non-compliance. It's incredibly frustrating. This is my mom to the T. Just diagnosed. She giggles and says she's being naughty when she doesn't follow orders. So hard to watch because I know it's going to kill her. I'm sure this person didn't almost die, but I was once in a consult where the outcome was this. Patient complained that stomach hurts when he drinks too much beer. Recommendation: drink less beer. Any guesses about exactly what that guy did not do? Patient: doctor, my hand really hurts when I place my arm above my head and wave it around like this. Doctor: then don't stick your arm over your head and wave it around like this. A PT just signed out AMA from my IQ a few months ago. He had just gotten extubated, had been on CRRT for about a week, was generally non-compliant, obese, COPD, DM type 2, etc. He was very belligerent to staff and his family. Made it to the lobby before he coded. We got him back and brought him right back to the unit. Family made him comfort measures and withdrew care because it was obviously not what he wanted. He was 42. That's heartbreaking. For the family, mostly, but also to think how young the guy was and just absolutely did not have to die, but was too stubborn and ridiculous to accept aid. Had a guy come in the ED with an allergic reaction to peanuts. I tell him, hey, no more peanuts because each allergic reaction gets worse and worse. I send him home with a prescription for an EpiPen in case he is accidentally exposed to peanuts and tell him to follow up with an allergist. The next day he is back, barely breathing and vital signs in the dumpster. Wife is with him and tells me he filled the script for the EpiPen, gave himself the shot ahead of time and then ate a peanut butter and jelly sandwich because that would be okay. Despite my strict instructions to stay away from peanuts and his wife yelling at him not to do it as he was spreading the peanut butter on the bread, guy ended up intubated, tube down the throat for breathing, and chest tubes on both sides because his allergic reaction was so far along. He was in the IQ for 2 weeks because they couldn't wean him from the vent. Last I heard he had permanent lung damage and is on a bunch of meds just to get through the day. All for a PB&J. I don't fully blame this guy because addiction is complicated. Head and neck cancer requiring a total laryngectomy. Voice box gone and now his trachea, windpipe connected to the lungs, is sutured end onto his neck, meaning he can only breathe through this hole and now his mouth only leads to his esophagus, swallowing tube. Guy kept smoking through his mouth, knowing it wouldn't even reach his lungs for the full nicotine benefit, and developed a second cancer in his mouth that required surgery. My grandmother fell and broke her hip. She had it repaired and was in a skilled nursing facility during her recovery. Now, she also had emphysema. Accordingly, she roomed with another older woman with emphysema, and as I understand it, she was told repeatedly about how there was one place that she could smoke outside and she absolutely could not smoke anywhere else. Yes, she had emphysema and flatly refused to quit smoking even as it progressed. She got up and went into the bathroom in her room in the middle of the night, lit up a smoke while on oxygen, which she wasn't accustomed to, and quite literally blew up the room. She had 3rd-degree burns over about 25% of her body, received a bunch of grafts, and was in the burn unit of the ICU for a while until her heart gave out the day after she got upgraded from ICU. Visiting her in the hospital was the most traumatic thing I've ever seen. It's been about 15 years now. I miss her all the time. Young 20-something severe alcoholic, cirrhosis, esophageal varices, came in with massive G-bleed, hypertension, HGB 3.9, was doing massive transfusion protocol, found the guy shakily ambulating to the in-room toilet with melina draining down his leg. If he pulled his line it would have been over. Couldn't believe that guy. Never met more hardcore young alcoholics than immigrant field workers. I work in pathology and I notice all the frequent flyers who end up in the hospital every few weeks, with various functions declining each time. What's worse is finally seeing them come through my shifts with the medical examiners after the family wants an autopsy. Obligatory I'm not a doctor disclaimer. Friend's extended family member simply overregulated his diabetes. The miracle of insulin was just so great that he ate whatever he wanted and took insulin whenever his blood sugar got too high. His body lost all means of blood sugar regulation. He let a manageable case of diabetes degrade into a constant seesaw of eating too much sugar, taking insulin to stay alive, and eating more sugar when he took too much insulin. Sometimes he would literally ask someone to go to the store for a Gatorade or a candy bar because he couldn't get off the couch, though this was after he was diagnosed terminal due to other complications. He passed a few weeks ago, called the ambulance from his car after taking a solo trip to a fried chicken joint. He was gone about 10 minutes before anyone arrived. Generous guy, just couldn't take care of himself. I am a medical professional, but this is about me, not a patient. I got into a car accident and was put on an NSAID, a muscle relaxer and Hydra, all uncoated meds. Each one of them said take with food, but I had to take the muscle relaxer 4 times a day and taking them with food wasn't always an option. I ended up giving myself gastritis. Now I can't take any meds that are uncoated. I lost 30 pounds and I'm still having digestion issues. I didn't almost die from this. My cousin had cystic fibrosis. She always wanted to feel normal and live like her friends did. She would regularly not listen to her doctors about medication or fight new procedures because of having to have an extended hospital stay. She was such a smart girl, but she died in her sleep at 22 when she could have had at least another decade. Seeing some of the improvements and innovations in treatments for CF in the years since give me hope for the kids growing up with it now. Please listen to your doctor. Days or weeks of inconvenience is far better than decades lost down the line. I miss her every single day. Not almost died, but did die. We had an older patient, late 60s if I remember correctly, who fell and hit their head. They were on antiplatelet medications for an irregular heart rate, atrial fibrillation. They were stable when we were called for the fall, but told them because they struck their head and were on that medication, the risk of internal bleeding was very high and they should go to the hospital and get a CT scan. They refused and signed off against our medical advice. Fast forward several hours and we're called back by family. Patient is unresponsive and presenting with decerebrate posturing. We were certain they had a massive intracranial bleeding. Died that night. Could have been avoided. Not a doctor or anything, but my grandfather ignored chest pressure for 3 months and only went to the hospital because you couldn't move, the pain was so bad. He had a heart attack. Don't ignore chest pains. Patients very often ignore medical advice, leave against medical advice, and are often seen within a few days or months for the same issue they were having, only exaggerated. Like if I could tell you how many times I've had someone in respiratory acidosis and how many times I've explained to them the risks of not wearing the devices or why they should stop using X drug, only to see them back in full-blown acute respiratory distress syndrome. Odds, being intubated or tracheed and eventually surviving and repeating the dang thing again or just dying finally is pretty high. I mean, sometimes people from the outside looking in think we are cold and caring individuals who show little emotions or sadness when we lose a patient, or are laughing and talking calmly to each other when performing post-mortem care, or when we straight up tell a patient that if they do not stop doing whatever they are doing they will die because of it. It's because we have seen so much of it and it's just become a part of our everyday life. You might be really surprised to find out stuff about some nurses if you ask them what they did before becoming a nurse. Just on my floor we have 5 nurses and 2 techs who were either airborne, Pirarasco, combat control, who saw lots of loss before even becoming nurses. We cut open a guy's stomach one night to remove the bag of C he swallowed. He signed himself out of the hospital in the morning despite us telling him that his stomach would explode. The next day he showed up at his old room and demanded we take care of him again. Obligatory, not a professional. I had an elderly neighbor. He had the lower apartment. I had the upper, in a duplex. He was on oxygen continuously due to extreme COPD, had pretty severe dementia, and complained about everything continuously, and the icing on the cake is that his girlfriend smoked like a chimney. I put girlfriend in quotes because I'm fairly certain that she was a predator after him for his money. I was working in the garden one afternoon and he comes flying into the garage, parks his car, and stumbles toward the door. He made it about 4 steps and throws me his apartment keys, shouting at me to run inside and grab a new tank of oxygen. He went out to test drive a new car for his and ran out of air. He was in the apartment for about another 6 weeks and social services moved him into a home. I hope they took his driver's license away too. I never saw him again. Work in pharmacy. Had a patient that refused to be compliant with his IV medications and had an extremely bad bacterial infection. Told me his body would figure it out and he wasn't paying any more money for us to just keep him ill. Next thing I knew, I get a call from us asking about his medical records and why we weren't supplying his antibiotics. This jerk tried to pawn it off on us that he was refusing therapy, ended up septic and lost a limb to infection. So I had a patient who was headed down to have an EGD and naturally we told them NPO after midnight. This woman was a hard intubation due to surviving a house fire, scalding damage to her anatomy, and after she was in PACU she had to be intubated and eventually switched rooms off my floor, med-surg, to the ICU. I went in her room to pack her belongings to be sent up to ICU after she arrived, and guess what I find in her bedside table? 2 half-drank bottles of juice and a bottle of prescription lorazepam. She was sneaking fluids and home meds, and instead of being in the hospital for just a couple hours post-op she gets to spend the next who knows how long in the ICU with aspiration, blood pressure in the 200s, tachycardia, and an inability to catch her breath. When we say NPO we mean NPFNO. Had a patient who was on 15L of oxygen tell me that he couldn't breathe with his mask on and taking the mask off helped him catch his breath. After multiple failed attempts at explaining to him that the oxygen mask would help him breathe and not hurt him, his oxygen saturation dropped to around 50%, very low, and his rest rate was like 40 a minute, very high. Eventually we got his mask on and he ended up being okay. He had a really distorted view of medicine and would regularly try to explain medical things to me that made no sense. Was interesting to say the least. I was barely what I'd consider a professional when I was an EMTB, but I've got a good one. We were dispatched to a private residence by hospital, which is out of the ordinary. The patient had missed appointments and the family wouldn't put him on the phone. Patient was in his 60s, frail and made his own medical decisions, so something wasn't right. We showed up and after some convincing they let us in. We found our patient lying on the couch covered in filth. The man was paralyzed from the waist down and had classic stroke-like symptoms. He was alert enough to legally refuse care, which he did, but after I explained he was literally dying he consented. The family disagreed, but it's not their call. I explained either he gets treatment or I'll get PD out here. All the while his abusive family was still eating dinner and drinking beers. What the heck? His vitals were terrible, so we made a command decision to load and go and not wait for more resources. The family wanted to come within the ambulance, but I refused. I made a full report at the hospital. The hospital referred the case to police and social workers. He had been lying on the couch for days and his family talked him out of going to the hospital. If I had it my way, his wife and the other 4 adults living in that house would go to prison. Hopefully they did. Not a medical professional, but a close buddy of mine was very afraid of his parents when we were teens, early 20s, and every time he was hungover his mom would take him to the doctor thinking he was sick and put him on antibiotics, and he would go along with it, and now his immune system is a mess. Any doctor that is prescribing antibiotics on a whim like that ain't a good one. Obligatory, not a doctor, but I had a bite, but I didn't see what bit me. Thought it was a hornet sting, but it kept spreading and it itched and hurt and was really hot to the touch. I was in college and on my mom's insurance, and I called her to say I thought I needed to go to a doctor. She told me suck it up, it's a bee sting. I finally went anyway, and it was infected. It was spreading to my lymphatic system, and it was almost certainly a black widow. I had an accident when I was around 12. TLDR, fell from a fair height into water onto my back and got trapped. This is when I started to get strange, horrendous leg pain. It would creep through my legs, burning, tingling, and like pins and needles, and intense pain. Last for hours or sometimes a whole day, then just slowly disappear. My mum took me to the hospital once because it happened while I was at school and they freaked out at how much pain I was in. A doctors told me to GTFO because it was leg cramps, and my mum told me it was because I crossed my legs too much. 7 years later, I meet someone and they push me to go see a doctor. GP sends me for CT scans, finds nothing. They refer me to a neurologist. They instantly send me for a MRI. Instantly finds out I tore my spinal cord in the original accident, and the intense nerve pain is from a build-up on fluid in the gap in the cord. It's uncommon, but not rare. But watching doctors Google your condition in front of you with a WTF expression on their faces is kinda entertaining. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.